Welcome from Manipal Hospitals, Bangalore. So here we have the surgical oncology team from Manipal Comprehensive Cancer Care Center. So we'll start with Dr. Hemant. He is the senior consultant in surgical oncology, Manipal Comprehensive Cancer Care Center, Manipal Hospital, South Road. And this is Dr. Pratima Raj. She is a gynec onco surgeon from Manipal Comprehensive Cancer Care Center. And Dr. Mohammed Basheeruddin. He is a surgical oncology and robotics specialist from Manipal Comprehensive Cancer Care Center. So over to you, doctors. The discussion will be on the cancer burden in India and the how in West Bengal how it is increasing, and also the current prevalence of cancers in India and the treatment advancements, and how Manipal Comprehensive Cancer Care Center is standing a unique way in curing the cancers and giving a new lease of life to the patients. Over to you.
Hello, welcome everybody to this press meet. So, welcome everybody to this press meet. I am Dr. Hemant, GM. I am a surgical oncologist, as was introduced. So, I am from Manipal Comprehensive Cancer Care Center, Manipal Hospital on Airport Road. So, we are one of the leading cancer centers in India. Then specifically, we are leading in Bengal. We have a state-of-the-art cancer center with all treatment facilities available under one roof. Chemotherapy, immunotherapy, radiation oncology. The most advanced equipment in oncology is present in our cancer center only. When I am a surgical oncologist, so I am in the surgical branch of oncology. So we at Manipal Comprehensive Cancer Center deal with cancers in a very unique way. We believe that one size fits all is not the right dictum for cancer anymore. So previously for cancer treatment, there used to be 4 or 5 medicines. Irrespective of the type of cancer, only those used to be given. But now times have changed, and especially in surgery, there has been a paradigm shift in the treatment of cancer with the help of surgery, and we are on the cusp of a technological revolution, so to speak. So at Manipal Comprehensive Cancer Care Center, we do precision surgeries which are tailored to the specific needs of the patient. So we make sure that the surgery is not too extensive, but is adequate for cure. So this is a significant shift from where we were a few years back to where we are now. So going forward in this press meet, my colleagues here also will elaborate on all the things we do to make sure patients are treated accurately, they go home faster, and I would like to emphasize here that we follow what is known as ERAS protocol, Enhanced Recovery After Surgery. We are the only center. We are the only center who's got a certificate for ERAS, and we follow certain protocols for earlier recovery of the patient. So by following these protocols, patients recover very early from supra-major surgeries, go home in a couple of days, lead a normal, close to normal life. They get back to work within the week of surgery. For the most complex surgeries, we use a lot of technology, equipment in our centers so that the recovery is faster and they go home very quickly and they're able to lead quite a normal life. So the scars in surgery, in cancer surgery, are getting smaller and smaller. So we'll be elaborating on this as we go ahead further. So I would like to emphasize that we at Manipal Comprehensive Cancer Center, we follow precision oncology, precision surgery, and we tailor the surgery, the treatment, oncology treatment to the genetic or the molecular makeup of the cancer which the patient is suffering from. So I'll now hand over the mic to Dr. Basheeruddin, who's going to tell you a few more things about the technological advancements which we are utilizing in Manipal Comprehensive Cancer Care Center.
Thank you, Dr. Hemant, for the nice introduction. So, I'm Dr. Basheeruddin. I'm a surgical oncologist and a robotic surgeon at Manipal Comprehensive Cancer Center. So, I think I'll speak in Hindi if everyone is okay. So, first of all, let me just introduce what is a cancer. Cancer basically is uncontrolled population and uncontrolled growth of the cell. So there are a few cells which decide to grow on their own, when this happens, it becomes a cancer. So that is what is it is in a layman's term. So कैंसर को ट्रीट करने के लिए बहुत सारे ऑप्शंस हैं, और उसमें एक है सर्जरी, जिसको हम रिप्रेजेंट करते हैं, हम सर्जिकल ऑन्कोलॉजिस्ट हैं, मतलब ऑपरेट करके अगर ट्यूमर निकालते हैं तो वो सर्जिकल ऑन्कोलॉजी का जॉब है। और दूसरा है कीमोथेरेपी, जिससे इंजेक्शन या दवाइयां देके कैंसर को हम मार सकते हैं। और तीसरा रहता है रेडिएशन, जिससे सिकाई देके हम रेडिएशन से ट्यूमर को खत्म कर सकते हैं। तो ये ब्रॉडली 3 कैटेगरीज होते हैं ट्रीटमेंट के लिए। और कॉम्प्रहेंसिव कैंसर सेंटर, जैसा डॉक्टर हेमंत ने आपको बताया, is a combination of having all the treatment modalities under one roof. इसमें सिर्फ सर्जिकल ऑन्कोलॉजी और मेडिकल ऑन्कोलॉजी, रेडिएशन ऑन्कोलॉजी पे सीमित नहीं रहता ये। इसके अलावा हमको रहता है एक चीज है रेडियोलॉजी, मतलब जहाँ पे हम डायग्नोसिस स्टार्ट होता है हमारा स्कैन के द्वारा, और एक बार हमने ट्यूमर को देखा फिर उससे बायोप्सी करना होता है, उसको करते हैं इंटरवेंशनल रेडियोलॉजी। और अगर हमको और बड़ा स्कैन करना है तो उसको बोलते हैं न्यूक्लियर मेडिसिन। सो ये सारे सुविधाएं आपको एक ही छत के अंदर आपको मणिपाल कॉम्प्रहेंसिव कैंसर सेंटर में मिलेंगे। और वही हमारा सबसे बड़ा एडवांटेज है क्योंकि पेशेंट को यहाँ से वहाँ घूमना नहीं पड़ता। और ये सारे जो लेटेस्ट टेक्नोलॉजीज हैं एक ही रूफ के अंदर है। और a few figures, let me just introduce you to. So if we talk about West Bengal, हम लोग बहुत सारे बंगाली पॉपुलेशन को केटर करते हैं मणिपाल में। Almost 5,000 लोग in a population of 1 lakh are expected to develop cancer in their lifetime. So which is a very high number. ठीक है, 5,000 लोग over 1 lakh, और majority of the cancers are caused by something called as carcinogens, मतलब कैंसर कॉज करने का एक जो जड़ होता है उसको बोलते हैं कार्सिनोजन। और इंडिया में सबसे कॉमन कार्सिनोजन है अनफॉर्चुनेटली टोबैको, जो गुटखा के रूप पे या बीड़ी या सिगरेट के द्वारा यूटिलाइज किया जाता है, और उससे मुंह का कैंसर, थ्रोट का कैंसर, जीभ का, जबान का कैंसर और लंग का कैंसर ये बहुत ज्यादा है। और अगर मैं बंगाली पॉपुलेशन की बात करूं तो सबसे कॉमन जो मेल्स में, मतलब पुरुषों में देखा जाता है उसको बोलते हैं हेड एंड नेक कैंसर। 20% से ज्यादा हेड एंड नेक कैंसर का लोड है। और नेक्स्ट नंबर पे आता है लंग कैंसर, ये भी ऑलमोस्ट 20% तक का है। फिर उसके बाद प्रोस्टेट, कोलोन और स्टमक कैंसर की बारी आती है। और जब हम बात करते हैं फीमेल्स की, मतलब लेडीज का जो कैंसर है उसमें सबसे ज्यादा है ब्रेस्ट कैंसर, और ऑलमोस्ट 25% इज रिप्रेजेंटेड बाय ब्रेस्ट कैंसर। उसके बाद है यूट्रस का कैंसर। और इन सब को ट्रीट करने के लिए हमारे पास एट मणिपाल वी हैव द लेटेस्ट टेक्नोलॉजी। उसमें सबसे अच्छा अभी जो विच इज फॉलोड अक्रॉस द वर्ल्ड, से अब यूएस जाए, यूरोप जाए, वहां पे मिनिमल, पहले क्या होता था अगर कोई पेट का सर्जरी करना है या थोरैक्स का सर्जरी करना है तो पूरा कट करके उसको ऐसे, मतलब पूरा सेपरेट करके बहुत बड़ा कट होता था, और इससे पेशेंट को रिकवर करने के लिए बहुत ज्यादा टाइम लगता था। तो नाउ वी हैव समथिंग कॉल्ड एज रोबोटिक सर्जरी, वेयर वी मेक 1 सेंटीमीटर से भी कम के 4-5 कट्स होते हैं, और वहां से हम दूरबीन डाल के और मल्टीपल इंस्ट्रूमेंट्स यूज करके मेजर से मेजर सबसे बड़ा भी सर्जरी हम उससे कंप्लीट कर पाते हैं। और उससे पेशेंट नेक्स्ट डे बिल्कुल चलने फिरने लगता है, खाने लगता है। पहले इसी को करने के लिए 8 या 10 दिन लग जाते थे पेशेंट को अगर अच्छे से चलना है, और पेशेंट का दर्द भी बहुत ज्यादा हुआ करता था। पहले जैसे अभी मान लो कैंसर किसी को हो गया तो वो उसका मतलब डेथ सेंटेंस टाइप, अभी ऐसा नहीं है। लॉट ऑफ कैंसर्स आर क्योरेबल। अगर क्योर नहीं भी होता है तो उसको हम डायबिटीज, हाइपरटेंशन के जैसा क्रॉनिक डिजीजेस में कन्वर्ट कर सकते हैं। तो इससे बहुत ज्यादा अभी फायदा हो रहा है पेशेंट को, और हमारी इच्छा यही है कि मणिपाल में और हम टेक्नोलॉजी अडॉप्ट करते जाएं और पेशेंट्स को सबसे अच्छे जो बेनिफिट्स हैं हम देते रहें। तो I would now pass on the mic to Dr. Pratima. She'll elaborate a little on gynecological cancers.
Good morning, all of you. I'm Dr. Pratima, Associate Consultant in Manipal Hospitals, Bangalore. So already Dr. Hemant and Dr. Basheeruddin sir has already mentioned you about the latest advancement in cancer treatment and also some positive factors for cancers. So I would like to tell a brief about gynecological malignancies. So what are gynecological malignancies? Gynecological malignancies are malignancies that occur in female reproductive tract, that is ovaries, uterus, cervix, vulva, vagina, and fallopian tubes. So all these cancers that occur in female reproductive tract are called as gynecological malignancies. So now these days we are seeing that there is a trending increasing in these cancers, like cervical cancer, followed by uterine cancer, as already Dr. Basheeruddin has mentioned, and then ovarian cancers. So, but these cancers have they have a good we can predict them in early stages, like cervical cancer, uterine cancer, and these when these cancers are detected earlier, they have a good curative. So how can these cancers be detected earlier? So these they have certain screening tests where a woman should undergo routine in a periodic time. So for cervical cancer, a woman has to undergo a screening test, that is pap smear and HPV DNA test every 3 years or every 5 years, up to the age of 65 years from the beginning of 30 years. So by doing this, if there are early pre-cancerous lesions, that is still the cancer has not formed, but there is a pre-malignancy state. When this can be detected through certain tests called colposcopy, or a pap smear or HPV DNA test, which are available at our Manipal Cancer Conference Center. So through these early lesions are detected, and then when they are treated, when they are treated and there is a 100% curative state for this. Even endometrial cancer also has early symptoms, that when patient present with postmenopausal bleeding, and when it is in early stage, with these certain minimal access surgeries like laparoscopy or robotic surgery, and with a good surgical margins, and the surgery and the patient can have a good curative stage when it is detected early at early stage. And for cervical cancer, we also have a HPV vaccination, which is a primary prevention method for cervical cancer. So this HPV vaccination, which is available in India now, so this vaccination can be given to all the girls from the age 9 years up to the age of 14, and it can also extend it up to the age 45 years. So this dosage is up to the 14 years. From the 9 years to 14 years, you can give at one dose, and then from the 14 years to the 45 years, you can give it as a two doses. So even after taking the vaccination, you have to undergo a regular pap smear and a HPV DNA test screening, that is every 3 or 5 years. At least by taking this vaccination, that is HPV vaccination, 90% of the time we can prevent cervical cancer, because cervical cancer is mostly caused by HPV, that is human papilloma virus, at 90% of the times. So, and even ovarian cancer, when coming to the ovarian cancer, see for ovarian cancer, like in endometrial cancer or cervical cancer, there is no screening recommendation, there is no screening guidelines. But there are certain signs and symptoms where a woman can go and approach to their oncologist. That is women, if she is having age group, if it is more than 50 and postmenopausal women, or if it is advanced age, if she is having persistent pain abdomen or a bloating sensation, heaviness in abdomen, she is not feeling like eating, if there is early fatigability, and if she is having early satiety, that is she is having increased vomiting and she is not able to take food, and if she is having postmenopausal bleeding, irregular bleeding, if all these complaints, if she is having any problems with her bowel movements, that is constipation or diarrhea, if she is having increased urge in urination or difficulty in passing urine, if all these symptoms are persisting, even with the local physician, even with the conservative management, if these symptoms are not going away, then definitely she should undergo to a higher, subspecialty like oncologist, and get screened, or get certain scans done, and then evaluate herself. And by doing this, maybe most of the time these cancers are detected in early stage, and when cancers are detected in early stage, they have a good cure chances.
Thank you, doctor.